I'm Dr. Chetlen Crossnoe, and I'm a family medicine doctor here at Grace Clinic. And today we're going to be talking about prostate cancer screening. Now, prostate cancer screening is a bit of a complicated topic. It's actually changed a lot in recommendations over the last several years. And currently, most medical organizations actually recommend against prostate cancer screening. We're going to talk about why that is and what that means for you and your loved ones in deciding about this in this talk. So first, let's talk about the prostate. The prostate is located just below the bladder. So here's the bladder with the ureters coming in from the kidneys. Of course, this is just an illustration. It doesn't really look quite like this, but and then the urethra that leaves at the bottom. In women, the urethra is short. It leaves just out into the world. In men, it's longer. It goes down and then out through the penis. And at the bottom, in men only, is the prostate sitting here around the urethra. It completely encircles the urethra. It's right at the point where the seminal vesicles from the testes are coming in, where they carry sperm. The purpose of the prostate is to secrete part of the semen. But due to its location here, right at the outlet of the bladder, it does tend to cause a lot of problems. You can imagine that anything that makes the prostate swell, such as an infection or cancer, or really most men just, their prostate gets larger as they get older, can cause difficulty with urination. So that's kind of the fundamental problem with the prostate. So prostate cancer. Prostate cancer is actually a very common form of cancer. About 16% of men will be diagnosed with prostate cancer in their life. However, only about 3% of men will die from prostate cancer. That means that about 80% of people or men who are diagnosed with prostate cancer will not die from that. It really is one of the less aggressive, usually less dangerous forms of cancer. In fact, men who are diagnosed with cancer that's confined to the prostate or just locally invasive have a 5-year, 99% survival rate. That's one of the best of any kinds of cancer. Now, there are cases of metastatic and much more dangerous cancers of the prostate, but in general, we have to think of it that way, that the vast majority of prostate cancer is relatively slow growing and easy to treat. So how do we diagnose prostate cancer? Well, there's really basically two ways of diagnosing cancer. First of all, if we evaluate symptoms, and second of all, through screening. Evaluating symptoms of prostate cancer would include, now if it's just local to this area, then the symptoms of prostate cancer usually are urological. Things like pain with urination, difficulty urinating, or blood in the urine can be signs of prostate cancer. If the cancer spreads, then it will have more typical signs of other kind of cancers, things like fatigue, weight loss, or bone pain. Obviously, any of these kinds of symptoms, you need to see your doctor or a urologist. But what about cancer screening? That's what we're really talking about today. There are two major ways of screening for prostate cancer. The first, the older way, is through a digital rectal exam. This is the thing that most men hate. They don't come to the doctor for it. And it involves putting the finger into the rectum and feeling the prostate through the wall of the rectum. I don't do that anymore in my practice. I find that a lot of men choose not to come to the doctor at all if they think that's going to happen. And so I don't do that anymore. Studies have generally not shown that digital rectal exam is very effective at finding cancers at appropriate times. The other form of prostate cancer screening is using a blood test called the PSA, or prostate-specific antigen. The PSA is a protein that's secreted by the prostate and can be at higher levels if the prostate is damaged, either through an infection or what we're concerned about is through cancer. So if we do choose to screen for cancer, obviously the benefit that we're trying to get is to find cancers at an early stage when they're easy to treat. But we have to remember that there are some risks of screening as well. If a PSA is elevated and the person chooses to pursue that, the next step is to get a prostate biopsy. That's where they place a probe into the rectum and shoot a needle into the prostate, and they do that 12 times. So that they do manage to control the pain reasonably well through anesthesia, but it's still not a fun thing to do. So that's a downside. And then if prostate cancer is found, then the treatment of that can sometimes cause problems as well. If a man chooses to have his prostate out, get a prostatectomy, then, or if they choose to get radiation to the area, then a lot of times have problems with erectile dysfunction or with incontinence. Usually those things get better, but not always. So there's some definite risks of screening for prostate cancer. So knowing all of that, who should be screened for prostate cancer? Currently, there are no major medical organizations that recommend screening everybody for prostate cancer. Now, again, that seems a little strange. If there's something we can find early, shouldn't we do that? But we're talking about the general population, there doesn't seem to be good survival data on that. If they take, the large studies have taken, 100,000 men, divide them into groups, and screen or not screen, and that does not show longer life or healthier life in the people who are screened. They do find more cancer, but what we really care about is living a long and healthy life, and it doesn't seem to help that. Well, so currently, some organizations, such as the American Cancer Society and the American Urological Association, recommend going over all this information and then using shared decision making to decide on screening or not. Other organizations, such as the U.S. Preventive Services Task Force and the American Academy of Family Physicians, recommend against screening. But what about subgroups of people? There may be some groups of men that would benefit more from screening. Specifically, if a person has a strong family history of prostate cancer, and we usually mean a first-degree relative, which is a father or brother with prostate cancer at a young age, these people would benefit more from screening. Also, Black men get prostate cancer at a higher rate and can benefit more from screening. There are also some groups of people who should not be screened. Men under age 40 get prostate cancer vanishingly rare, and there's no benefit for screening. Men over age 70 do get prostate cancer, but due to the slow-growing nature of the cancer, they're more likely to die of something else, so they should not be screened either. I hope that's some good information for you, and it will help you decide about prostate cancer screening for yourself or for your loved ones. Thank you.